This is Dr. Mansi from Homeopathy 360, and I'm back again on the Beyond Boundaries with Homeopathy 360 webinar series, in which we have today Dr. Paolo, and today's webinar session is on the topic Decoding Causticum through Clinical Evidence. Now, let me introduce our today's speaker, Paolo Pifferi, born in Folletta, Italy on October 26, 1959, currently living in the province of Livorno, Italy, in Solvay. Degree in medicine and surgery at the University of Pisa, with a thesis on dietary treatment of dyslipidemia in pediatric age. Activities as emergency medical doctor from 1988 to December 2024. University diploma in clinical nutrition and dietetics in 1997 at the University of Siena, with a thesis on celiac disease nutritional aspect in pediatric age. Free professional activities in the discipline of dietetics and nutrition, constant congressional and continuing education activities in nutrition, and since 1987, constant congress activity and updating in nutrition. Graduated homeopath in March 2017 at the IRMSO school in Rome, since the constant updating in advanced courses held at the same school, and intense congress activity as a speaker and moderator with homeopathy and nutrition congresses, former member of the board of directors, ADI Toscana, collaboration with the journals Sebum on the university, and accredited tutor for degree courses in nutrition. Board member of FAMO, participation in the editorial board of the magazine, in the LMHI Spotlight magazine, member of the translation group of LMHI THP magazine, and much more. So, it's our pleasure to have you today on the 360 platform, and we are going to learn on Causticum. So, sir, thank you so much for coming on Homeopathy 360 platform and for sharing your valuable insights. So, please begin.
Okay, thank you. I'm sorry, I saw the registration active and I begin to speak. Sorry, I repeat my introduction. Okay. So the first, I would like to express my thanks, my heartfelt thanks to Dr. Vrando Verma and Dr. Mansi Tyagi for the honor that they are bestowed upon me and to all the staff at Homeopathy 360 who have worked and are working on this webinar. Thanks so much also to my teachers at the Irmers School in Rome in alphabetical order, Pietro Federico, Renzo Galassi, Pietro Gulia, for teaching me and continuing to teach me the wonderful science of homeopathy. I hope it will be a pleasant chat among friends who are passionate about homeopathic medicine. Obviously, I have nothing to teach anyone, but I just want to share a few small fragments of what my teachers have taught me. Now I begin my presentation. So we are speaking about Causticum, a clinical case of urinary incontinence and polyuria resolved by Causticum. This is me. I would like to emphasize that the clinical case was approached strictly in accordance with the Hahnemannian doctrine, in accordance with the sixth edition of the Organon. I want to premise that in Italian healthcare system, homeopathy is seen as a complementary medicine, and unfortunately, homeopathic medicine is subject to many attacks from official allopathic medicine. For this reason, even though those of you listening to me may find this strange, those who practice homeopathy must not only treat patients according to the principles laid down by Hahnemann, but also protect themselves from legal attacks. We must therefore proceed with extreme caution when our principles clash with those of allopathic medicine. This is the Italian situation. The clinical case, December 9, 2022, a friend of mine, 73-year-old patient, comes to see me reporting a serious problem of polyuria and urinary incontinence that has been afflicting him for a long time, for which he has consulted numerous urologists and nephrologists who, after numerous tests, have not reached a diagnostic conclusion and consequently a therapeutic one. Family history: father died at age 85 from undefined heart disease. Mother died from heart disease and severe anemia. Siblings, no one. Grandparents, he remembers his grandparents fondly, but cannot specify the causes of and ages of their deaths. He does not recall any particular pathological episodes in childhood and adolescence, except for common childhood illnesses. He is taking various medications and supplements, tamsulosin, doxazosin, atorvastatin. Despite the treatment with tamsulosin, which a neurologist prescribed for an unclear prostatic hypertrophy, the patient continues to be forced at short intervals to interrupt his activities to find, with an extreme urgency, a bathroom. He is retired for many years. He managed to obtain an early retirement at the age of 49 from a state-owned company he worked for, and has since started his own graphic design business, assisted by his wife and one of his children. He began working at a very young age in order to help his parents, and also because he had no passion for studying. Always involved in social activities, he has been involved in various charitable associations where he has held important positions. An idealist, he is committed to social and political causes. How he tells about himself. He has a difficult relationship with his wife because she has minor health issues that she tends to exaggerate and for which she always feels very ill and has to consult 1,000 different specialists in various parts of Italy, always trying to obtain the worst diagnosis. My patient, therefore, has to indulge his wife and accompany her to various appointments, as well as putting up with all her worries and complaints. All this makes him very nervous, and he feels crushed by his wife, from whom he does everything he can to stay away, inventing odd jobs, commitments, and similar things. The patient himself is also very anxious and concerned about his health, especially his cholesterol levels, so he follows a very strict diet and exercise intensely. He is passionate about campers and often joins groups of campers enthusiasts with whom he has taken long and challenging trips, but during these trips he is forced to stop countless times to urinate. He suffers greatly from cold, especially since he lost weight due to to extreme attention to what he eats out of concern for his cholesterol. He loves to talk about politics and is always critical of anything he considers to be authority. He is frequently argumentative and has always been a protester with the tendency to make cutting critical remarks about everything and everyone. He tires easily. He feels worse when he wakes up. He feels worse in the cold and better in the heat. And he particularly cannot tolerate dry cold. Urinary symptoms worsen when walking and during the night and are aggravated by cold weather. He often has to get up many times during the first part of the night, often losing urine. He does not feel the urge. Even during the day, he may not feel the urge to urinate and find himself wet with a few drops of urine. Extremely meticulous about everything, he tidies his camper perfectly before and after every trip, making sure that everything is exactly in its place. It's very characteristic, this passion. Despite his attention to the quality of foods that he believes could raise his cholesterol, he has a decent appetite, even though he often suffers from gastritis. He prefers smoked and salty foods. He does not tolerate bread very well, as it upsets his stomach. He does not like coffee, which makes him feel unwell, and he does not like sweets. He is often very thirsty, especially after meals. He reports frequent pain along his spine at various levels. He described himself as very sensitive, witty, generous to others, and concerned about his neighbors. Easy to cry, often a little down in the dumps, almost depressed. I think depressed is a good term for him. I observed the patient through the eyes of a homeopath, thin, pale, with slightly tense and stiff neck muscles, a slightly drawn face, slightly hunched forward. I decided to take many of the symptoms he reports and repertorize them, aware that these symptoms will certainly be too many according to the teachings of my teachers at Hermso School in Rome. But I do anyway, performing two slightly different repertorization. The first using the sum of the symptoms, and the second using Ortega's miasmatic evaluation form to evaluate symptoms belonging to the three miasms: psora, psychosis, syphilis. In the form, some of the symptoms, and we'll look then, some of the symptoms are not assigned to the three miasms and are indicated as not classified according to Ortega. But it can be noted that in reality, some of these could be interpreted as mostly pertaining to psora or psychosis. As Hahnemann states in chronic disease, if there is no clear prevalence of symptoms related to a miasm, in which case we should start treatment with a remedy that acts predominantly on that miasm, it's advisable to start treatment by trying to act on the most clearly psoric symptoms. In this case, this method was used. And this is the repertorization. The first repertorization, the sum of the symptoms. There are too many symptoms. There are 17, but it's useful for an idea. I took the principal symptoms, and this is the repertorization with the Ortega miasmatic repertorization. So we can see that there are many symptoms that are non-classified, but the prevalence we can see are symptoms psoric or psychotic. It seems clear that the remedy that could be suitable for my patient is Causticum, which has psoric and psychotic properties. The patient tells me during a previous homeopathic consultation with another colleague he had taken Natrium muriaticum, which had provided some benefits for a short time. We can indeed see that Natrium muriaticum covers some of the patient's urinary symptoms, but does not take into account other aspects. The patient's sensitivity to cold, his first characteristic, his idealism, and his desire to serve others. We can see Natrium muriaticum in very, very far from Causticum. December 2022, I prescribe Causticum in globules MK, 1 dose tube. The patient will take only half of the globules contained in the tube. I ask the patient to call me if he experiences any unusual symptoms, and I decide to see him again in 30 days. I see again on February 1st February 2023. The patient says he's feeling better. The urinary symptoms are gradually subsiding, but although they still persist. I prescribe Causticum MK. Again, the globules that were left over from the previous administration, but this time diluted in 50 ml of water and dynamized 10 times. March 21, 2023. I see the patient and he reports that he has had further improvement. His mood has also improved, as he can now sleep through the night without having to get up too often to urinate, and his social life is less compromised by the unpleasant situation of having to leave frequently to find a place to urinate. Given the satisfactory results, I consider it reasonable to continue with the Causticum and to administer it with a certain regularity. For this reason, I decide to switch to administering Causticum set LM drops, 2 drops in a little water every other day, subsequently extending the frequency of administration to 2 drops every 3rd day. I have no further news of the patient until July 9, 2024. Why? During one of these trips, he was hospitalized for pneumonia, treated with allopathic medicine, antibiotics, cortisone. I find the patient emaciated, feeling cold despite the 30-degree temperature, very agitated, restless, and craving warm things. The urinary symptoms had reappeared strongly after hospital treatment. Arsenicum comes to my mind. The clinical picture seems quite clear to me, but I decide not to improvise and to calmly evaluate the symptoms. Repertorization with radar opus comes to my head, and I prescribe arsenicum MK, one dose of a few globules immediately and another dose to be repeated after a week in water. This is the repertorization, mind, restlessness, emaciation, lack of vital heat, helms during convulsions, anxiety, warm drink desire. On July 31, 2024, the patient returns for a follow-up visit and is feeling much better again. The urinary symptoms that had been significantly reduced before his hospitalization for pneumonia persist. After re-evaluating the symptoms, I prescribed Causticum 7 LM again, resuming the interrupted therapy. I spoke to the patient several times by phone, and he reported a gradual improvement in his urinary symptoms. At the end of November, while he was traveling once again, he developed a sudden fever with a cold and was admitted to an emergency room in northern Italy, where he was diagnosed with Pseudomonas aeruginosa pneumonia. He was kept in the hospital for a long time and treated with specific antibiotics and corticosteroids. I only learned of this when the patient returned home and came to my office for the visit we had already scheduled for January 15, 2025. This time, the patient had no significant symptom after antibiotic and cortisone therapy, and I decided, given the return of the urinary symptoms, to resume therapy with Causticum, this time switching to 12 LM potency in drops, through 2 drops per day for 3 days, and then 2 drops twice a week. I see the patient again in March 2025. Convince him to permanently stop taking tamsulosin, which he had continued to take anyway, and to continue only with the homeopathic remedy. He is much better now. He can enjoy a normal social life without having to worry about having a bathroom nearby. He sleeps for at least 6 hours every night without having to get up constantly and without the fear of suddenly finding himself wet. I see him again a few days ago, 20 days ago, about August 5, 2025, and the situation is still improving. I prescribe Causticum, 18 LM, 2 drops once a week. Now I think it's normal to have some questions about my way of treating this patient. So I try to explain you why I do this. Why did I start the treatment with K potencies, continue with the K potencies until a certain point, and then switch to LM potencies? Would it have been more effective to start with high CH potencies? I gave myself some two answers. I did not know the patient's reactivity, and with the first administrations of Causticum, okay, I tried to assess whether the remedy was appropriate, even though I was reasonably sure, but reasonably sure does not mean completely sure, and whether it could cause any aggravation. When I realized that Causticum could indeed be the right remedy and that it would require chronic and profound treatment, I decided for LM potencies, according to Hahnemann in the 6th edition of the organ, where he says that LM potencies are gentle and more profound and could, if necessary, be administered daily. The reason why I did not start with high CH potencies, despite being reasonably sure of the remedy, is the same as I explained above. Reasonable possibility, but not complete certainty. So I would have exposed the patient to possible aggravation for no reason. I must also say that, as you know much better than I do, it is not wise to rely solely on repertories, whether paper or computerized. The repertory suggests, but the MateriaMedica must guide us. We can not have the base of our therapy only with repertories. Is MateriaMedica that will confirm the remedies is right or not right. So, before making the prescription, I looked up Causticum in Timothy Field Allen's MateriaMedica to see if matched the symptoms reported by my patient. Here are frequent urging to urinate. At night, frequent urging to urinate, which wakes him from sleep. Frequent urgent desire to urinate, which is passed in much larger quantity than the amount of drink taken. Very frequent urging to urinate with involuntary dribbling of urine. He urinates so easily that he is not sensible of the stream and can scarcely believe in the dark that he is urinating until he makes sure with the hand. involuntary passage of urine while coughing or blowing the nose. The urine passes at night in sleep. The last drops of the urine are delayed. So, can I say, yes, he's my patient? The symptoms are pretty clear, but let's take a look at something else as well. So, I look in on the guiding symptoms of Constantin Ehring. Here are not only urinary symptoms, but mental symptoms and general symptoms and others. So this is the patient: melancholy, disposition to weep, anxious, worried, and pale. Is my patient anxious, worried, pale, melancholy, disposition to weep, despondent, depressed, peevish, irritable, censorious mood. And another, thinking of complaints aggravates them. Appetite, thirst, desires, aversion. First, after eating, for cold drinks, desire for smoked meat, aversion to sweet things. Bread causes pressure in stomach. Smoked meat agrees. Coffee seems to aggravate every symptom. After eating, feels relieved, much first. I can say that many symptoms of Causticum are respiratory, and the patient was affected by 2 episodes of pneumonia. I have no answer about this. I don't know if during his travels he stopped the remedy. I don't know, but there are many respiratory symptoms in Causticum. And now we are back on Ehring guiding symptoms in urinary symptoms. Frequent urging to urinate day and night, constant ineffectual desire to urinate, frequent evacuation of only a few drops. This is the patient. I don't know if the patient has a spasm in rectum, constipation. This is unknown for me. Never evacuation of blood with urine. Patient said no. All sensation worse at night. And we can go on again with the urinary symptoms. Here are very frequent urging to urinate with involuntary dribbling of urine, involuntary passage of urine when cooking, sneezing, or blowing nose at night when asleep in walking, cannot retain urine and could not feel urine passing through urethra. Last drops of urine are delayed. Retention of urine with the frequent and urgent desire, occasionally a few drops or a small quantity may dribble away. Sleep. During first sleep wets the bed. And now let's see what is Causticum. Causticum Hahnemanni is the name, is the complete name, as you know. Is a product of the distillation of potassium bisulfate and lime. According to Dr. Wagner, it's a weak solution of ammonia hydrate with traces of ammonia sulfite. According to Dr. Pierre-Smith, it belongs to the group of ammonium compounds and not to those of potassium. The substance, whose chemical composition is not clearly defined, was introduced into therapeutic practice by Hahnemann and is obtained from the distillation of the mixture of potassium bisulfate and lime. It's a colorless liquid, clear as water. It has an astringent taste and freezes at low temperatures. It has caustic effects and can promote putrefactive processes in animal tissues. Homeopathic preparation is obtained by mixing 1 drop of the distillation product with 100 drops of alcohol to obtain the first centesimal dilution. Homeopathic experimentation. The remedy was tested by Hahnemann. The experimenters highlighted muscle weakness and depression. The patient, our patient, my patient, was depressed. General, experimental, and therapeutic action. Nervous system, tremors, cramps, muscle spasms, convulsions, paralysis, especially of the pharynx, larynx, and sphincters, joints and periarticular fibrous tissues, inflammatory and degenerative processes resulting in ankylosis, mucous membranes, inflammatory processes that selectively affect those of the respiratory and digestive system. And we come back to the respiratory system. General indication of Causticum. It's indicated occasionally in acute cases, more frequently in chronic cases, in children during puberty, in the elderly, in women, in subjects with asthenia, slow onset central or peripheral paretic phenomena, convulsions, urinary incontinence, burning pain, ankylosis, hysterical manifestation, and an anxious depressive state often arising after prolonged grief and worry. The patient was a victim, is a victim of his wife, and I think we can have a certain way to think is good. General indications: the adult subject is generally rather thin, asthenic, sensitive to cold, disease in my patient, hypersensitive to dry cold, disease in my patient. Their complexion is rather pale, yellowish. I remember the first time I saw the patient pale, almost yellow and he had an appearance unhealthy. From a mental point of view, it's worth noting their intense emotional charge and compassionate nature, hypersensitivity, emotionality, pessimism, a marked tendency to argue, and an anxious depressive state often result from worries, disappointment, and psychological suffering. So I think that the portrait of my patient is therefore complete, is a perfect picture of Causticum, and the results prove it. I want to thank you for your attention and patience. My English spoken not always is so good. I hope you accept this thing. Best regards from Italy and the entire Italian homeopathic community. It's very wonderful to be able to share my homeopathic experience with you, who are so knowledgeable. You are very expert, and so to share my experience with you is a very, very interesting occasion. I hope we'll have another chance to get together. It was really enjoyable, and I think I thank again would thank Jane Publisher and Dr. Vranda Verma and Dr. Mansi Tyagi for this honor. Any question? I go to the end. Is there any question? There are some questions. I thank you for the attention. I see Causticum is useful in case of suppressed urine or stricter urethra. The potency. I spoke about potency. I start from MK, and the last prescription was 18 LM. Causticum useful in case of suppressed urine or stricter urethra. Yes, it's true. Dr. Isha Meshram, I thank you for your attention, and it's an honor to share my experience with you. In Italy, is very difficult be an homeopath totally, because the National Health Service is not so do not accept homeopathy. We are considered complementary medicine. Renata Calieri. Okay, yes, I've talked about these many symptoms. It's true, and I know that are too many, but I want to use all the same a big repertorization to have a portrait sufficient adequate. In the last part of my considerations, there are all the symptoms of the patient, many very characteristic, but in the Ehring's guiding symptoms, I've not considered only urinary symptoms, but mental symptoms, general symptoms, and other. And the photo of the patient is good. The result says that the remedy was right, but too many rubrics, too many symptoms in the first repertorization, and in the second, I think 17 yes, 17 symptoms about for perhaps are too much, but was to also to be sure to capture all the symptoms. Dr. Nirma, potency, I spoke about this. Thanks. Dr. Satika Taranum, I thank you for being here. Any other question? Hope I have been clear, but I'm here for your questions.
Hello, sir. We can see the questions in question answer
Yeah,
box.
Dr. Nirma, repetition. Repetition of the remedy. The last remedy was Causticum 18 LM, 2 drops, 1 time a week. Because the patient is in good health, but I can't interrupt the remedy now. He's going better week by week, so I can stop the remedy. And I think in 18 LM, 2 drops in a week, it's okay. Now it's in good health. He is able to sleep 6, sometimes 7 hours per night. So I think it's a good repetition. This is my way to work. This is based on what my teachers taught me. Sometimes it's difficult to establish when repeat how much and so on. But step by step, I try to understand better every patient I see. Any other question? It's a pleasure to be here with you. Really a big honor. Dr. Rajesh Pal, MK, 1000 Korsakov globules at the beginning of the therapy to test the reactivity of the patient. I'm not so. I was sufficiently sure that Causticum was the right remedy, but I never begin with potencies too strong. So I use many times okay. You ask me to explain more about Ortega's miasmatic evaluation. Okay. Dr. Ortega was the most expert doctor in miasmatic treatment. He took again the concept of Hahnemann about miasma and made another a better interpretation. So when we treat a patient, if it's possible, we can start from the prevalent miasma. If there is no miasma prevalent, we live from psora, and we observe what happens treating this. In this case, there was the prevalence of psora and psychosis. So I decided that the Causticum, that is a remedy, psychotic and psoric, I use this for this characteristic. There are many remedies who cover the three miasms, lycopodium, calcarea, carbonica, but I think to be more sure, to be on the right way, to make evaluation also miasmatic. I don't know if I've been so clear. You can. I don't know if the time is finished, but you can also write to me by mail. My mail is indicated in the first slide. I can, so this is my mail, and if I can be more clear by mail, you can write me. Dr. Hisham Ashram is good, my explanation.
Thank you so much, sir, for this wonderful presentation. I guess you have cleared all the queries and doubts.
I think I have finished. I can't see any other question. Yeah.
Yes.
Okay. So we stop or
yes, sir. I think it's time to wrap up. And this video will be soon available on the YouTube of Homeopathy 360, where you can reshare the seminar, this webinar to everyone, and other people can also rewatch this video.
Okay. Thank you very much. You are
Yes, sir.
very, very, very kind. It's a very good, very and a special honor to work with you.
Yes. Thank you so much, sir. Bye bye.